How many in the room have heard of photogrammetry? I'm assuming by now, most everybody. How many actually have done a photogrammetry scan? By the raise of hands, raise it high if you've actually done a scan clinically. Okay, very good. I'm going to just speak today. There's so much I could talk about photogrammetry. I'm going to talk about the very basics, not getting into the science, okay? But what is photogrammetry is the first thing we'll go over, and just in general terms, okay? So you get an idea of what it is. Second, I want to talk about how it is changing full arch dentistry. Number three, we're going to compare some cameras, a brief comparison, so you kind of understand what's on the market and maybe some differences. I'm not tied to any program or any system. I don't get paid. I'm not an affiliate, anything. So I'm just, what I tell you is my own opinion. And then last, just a couple things to consider. So what is photogrammetry? So photogrammetry is a technology that's been around for 80 plus years. Okay. And it started with a guy who tried to capture accurate data to make maps. And this guy, I can't think of his name right now, but he got in a hot air balloon and he just stayed at a certain distance and he took photographs of the landscape. And photogrammetry basically is photography. Okay. What happened there? Okay. We'll keep going. Photogrammetry is basically photography of, of course, photography is a 2D image, and it's used as the inputs, okay, to create a 3D object. So from photographs, there are specific measurements that can be taken, and then those images can be conglomerated or merged or stitched through software to create a digital 3D image. It's pretty cool technology. It's used, like I said, in map making. It's used in crime scenes. It's used in shipwrecks. It's used in, if you've used Google Maps, they use photogrammetry. Like there's a lot of applications for photogrammetry to where you want to take something in the real world and make a 3D image of it, a 3D rendering. And the key is that it's very accurate. That technology takes that information and creates a 3D image very, very accurately. Okay, I don't know where we are. No, we're at the very end. If you could go back to the maybe slide 4 or 5. Nope, keep going. Keep going. Nope, actually, that's the wrong presentation. All right. Okay, so if I wanted to take an image, say I take this piece of fruit and I wanted to make a 3D image of this, you can see on the right side in the blue, photogrammetry is basically taking a bunch of photos, and you can see that those black line angles here are just photos taken of the apricot in different angles and different positions, okay? Hundreds of photos. And what you do is you take these photos, you put them into software, and then the software takes those images and through what they call triangulation and whatnot, they take data. And now if you see on the right side here, this is the digital file of that original piece of fruit. And so now I can take that image, it's a 3D image, and I can copy and paste it like any other file, okay? So I can use this for small objects. I can use this for large objects. For example, this church. If you look at all those data points, someone went around and took photos of this church. And then you can even see on this that they started walking into the church, okay? So the next slide is photographs taken walking into the church, and then photographs of even inside the church. You can see all the different places where photographs were taken. So now you take all those photographs. Here are the outside images. Here's the bird's eye view of the church. Here are the inside images of the church. And now what you can do is you can take and make a 3D rendering of this building. So it's used to preserve artifacts, right? These buildings that are falling apart, or if you wanted to take something that was like a piece of art, you can now take this through photogrammetry and render a 3D image. It's wonderful technology. Okay. You're going to see if I let this play longer, I've got 14 minutes. I'm going to let this play because you're going to see here shortly that it goes actually inside the church, inside the building. And it's a very accurate representation. You can use this if you wanted to study like a shipwreck. You could go down and take images of the ship, and you don't have to be underwater to sit and get the data. You can actually take in a 3D image and evaluate it on the computer. So here they're going to go in the church. Those photos are kind of giving us a 3D image. It's also used in gaming for those of you who like real world gaming. I don't know what happened again there. If you could pull that up again. Okay, so you get the idea. Photogrammetry can take any image and it can digitize or copy or duplicate large or small into an accurate rendering of anything you want to copy. If I wanted to take an image, make me a 3D image, I could walk into a room. I've seen this online where they walk into the room. There's maybe 300 cameras sitting around, and all these cameras are taking different images. Again, put into software, and now you have an actual 3D image of myself, my same size, my same weight, my same characteristics. It's very accurate. Okay, let's go next. Anything can be digitized. So the question now is, how is this applied in full arch dentistry? Well, a company out of Spain about 10 years ago called PIC, is familiar with PIC if you've used photogrammetry. And then about the same time, there was a guy named Horst Baer out of Switzerland. They had been working in photogrammetry for a while, and they realized that there's this problem in full arch dentistry that we have not been able to, as a profession, able to capture the accurate position of implants on an arc. That was very difficult, okay? So they, about 10 years ago, had this camera, and they started doing photogrammetry. For about 10 years, at least I'd never heard of photogrammetry till about 4 years ago. Now it's kind of starting to get popular. The problem is the camera's expensive. So it's kind of a hard sell, right? It's almost like saying, hey, I'm going to sell you a $30,000 or $40,000 way to take a final impression. Is anybody buying? Okay. And they had a hard time selling this camera. But in the last couple of years, it's really caught on fire because of digital workflows coming into full arch. And I'll make a point about that here in a second. So what problem does photogrammetry solve? Well, for years, if any of you have taken a full arch impression, it's the worst experience in the world. It's technique sensitive. The clinician has to know what they're doing. There's all kinds of rooms for error in the process. So if I want to duplicate the patient's implant position, typically we were doing verification jigs. We had stone issues, technique sensitivity clinically. So there were all these openings for us to actually spoil the duplication of that patient, right? And so what happens is we now go out and spend a lot of time trying to, and expense and cost to make this beautiful prosthesis on this full arch for it to only not fit. Anybody been there? I've been there. It's horrible. And now who's going to pay for the remake, right? So for me, photogrammetry solves this problem because, number one, I don't have to depend on people for that precious data. And I know that when I fabricate something on this implant position that photogrammetry has given me, I can count on it 100%. And the beauty is I've trained hundreds of assistants across the country on how to do it, right? So it's very simple. The problem is still cost effective. It's cost prohibitive. Okay, so intraoral scanning we've tried is a completely different technology. It's a key point. Can people do it with intraoral scanning? Yes. Do people have success with intraoral scanning? Yes, you can. The problem is it is technique sensitive. Okay, so meaning you have to know what you're doing, or you have to go through and get special training, or you have to learn through trial and error yourself. It's not just a 100% thing that works every time. So all photogrammetry, all intraoral scanning is taking small images and stitching them together, right? And when it goes across the arch, that's where we're missing the accuracy. Photogrammetry, on the other hand, is taking a picture of the whole thing, and it's taking multiple pictures at different angles. Okay, it's not stitching small photos together. And so the pink represents the camera, the blue represents the scan bodies, and you can see through the 4 cameras on the scanner that it's just taking pictures of those in different angles. And the software, just like the building and just like the apricot, is going to stitch those together. And what is the result of photogrammetry? The result is just implant position for now. And so I make this point. If you look here, what is important? Well, I now have an accurate rendering of the exact position of those implants in space and the relationships together. And it's about, I'd say about, depending on the papers you read, about 40 microns in accuracy. Very accurate. Okay. And so now I know I can count on that to build upon. So that's all it does. It doesn't do soft tissue. It doesn't do anything else. So what I like to say, and I say it often, photogrammetry in and of itself is actually worthless. All it is an implant position. But it becomes very valuable if I want to merge it with prosthetic data. Now it gets very valuable because what it's opening the door is opening the door for, I will say this, it has opened the door for digital workflows. If we did not have photogrammetry, I call it the enabling technology because it has enabled and opened the doors for digital workflows. If we didn't have this or the ability to count on it, then we'd be stuck with the old ways, right? And we'd still be mixing with analog and digital. Now there's no true digital workflow, but point being is that it has opened the door for digital workflows. And I want to just point out that it's just one record. I'll get into that here in a second. How accurate does it have to be? That's the question. What are we okay with in terms of misfit? Okay, so I learned this. I got this from iMetric, and I learned this in their course. It's a key point. Every step in the restorative process can introduce error. Okay, and this is called tolerance stack. So it's critical as we go from implant position to final restoration, we have to know that there's a process there along this restorative process that I can introduce error. Okay, if you look here, if your piggy bank for passive fit was 100 microns, beware that every step in the workflow adds up fast. ICAM captures the position about 40 microns. Intraoral scanning is less. You have milling, you have printing, you have human beings cementing tie bases, you have sintering, you have all these things that can add up. So when you stack them all together, you want to start at least with the most accurate thing possible. If your goal is to be within 100 microns, then I want to start with the most accurate thing possible, because when I introduce milling and when I introduce sintering, I want to be below the 100 micron threshold. So just keep that in mind, that this stacks up, and this is just one part of the restorative process. Quick camera comparisons. I've got 7 minutes. Let's go. Remember, the goal is to duplicate reality. That's what we're trying to do, okay? So I put this slide on. If you guys were to look at an object and cover one eye, okay, you would see that the relationship between the piggy bank and the clock would look a certain way. Now, if you cover the open eye and open up your other eye, it's going to look a little different. The reference is going to change. So what's the point here? Well, we all use triangulation every day because we look at objects with two eyes, and our brains can calculate the relationship between two objects through triangulation. And you actually get to see the object as it is and the relationship between the two. I point this out because iMetric is the only system that has 4 cameras, right? So it's seeing the object and comparing them with 4 different viewpoints. Why do I say this? I just say the 2 most common cameras on the market are PIC, which is on the left there. It has 2 cameras. Micron Mapper on the right has 2 cameras. How good is good enough? Just something to consider. ICAM has the 4 cameras. I have used all of them. They all work fine, to be quite honest with you. I personally, though, use iMetric. It works. It's easy to, I can train someone to use it. And it's just, for me, the simplest in my hands. Okay. Another thing to consider between systems. If you look at the flags, okay, I'm just going to point over here to the left. The flags are key because the cameras are taking images of one surface. Okay. So you have 2 cameras taking pictures of one surface in different positions. Okay. Just be aware of that. So if you look here at the slide, you've got 2 cameras, and it's just recording one surface in the relationship of one surface with another. I think where we run into iMetric which is helpful, is you have 3 surfaces. So if you look here on the screen, these scan markers, you have 2 surfaces and plus the top surface, and the camera's reading. So you have 4 cameras taking pictures of 3 surfaces, and those related to a lot more data we're acquiring with the same amount of photos. Okay. So it's just taking different angles and recording those relationships. So again, multiple surfaces. I just find that it's in my mind, it makes sense that I'm capturing more data with fewer photos. What does this all mean? Why do we talk about this? Well, if you guys understand what's going on in full arch, and if you've talked to me, you know I'm pretty passionate about full arch. We've made a lot of progress in the surgical side. In fact, every course in America, every course anywhere you go, it's about surgery, right? And that's what I call the sexy side. People like to go and they like to sell the case and they like to tell their buddies I did the surgery. But when it comes to the restorative, it's kind of like, what do we do? And this is where all the headaches come. This is where the experience starts going downhill because we don't have any standardization. So why do I talk about all this? I want to talk about McDonald's just for a quick second. I've got 3 minutes and 50 seconds. McDonald's, if you look at what they do, I'm kind of fascinated by their story. They have tens of thousands of restaurants all over the world. No matter where you go, the end product is the same. You order a cheeseburger, no matter where you are, you're going to get the same outcome every time. And they do this day after day, year after year, and they do it with teenagers. That's the miracle. And my thought has always been in the last few years, can we standardize? Is there a way to automate? Full arch is no different than any manufacturing process. We go through a process and the outcome is the final set prosthesis. And yet we're struggling getting to the final prosthesis, right? Is there a way to standardize those inputs? Is there a way to standardize and get that predictable outcome every time? Can we do that? That's the question. I believe we can, right? We're getting closer, regardless of the skill set of the clinician, right? If we had the equivalent of a teenager clinician, can I still get the same outcome? And we need standards and we need standardization systems. So the process for full arch is very simple. The process is exam, surgery, temp, final. Okay, with it resulting in a final prosthesis as the final product. The key here is that McDonald's is systems dependent. It's not people dependent. Full arch right now, and why we're all over the map on the end result, is that we are highly people dependent and hardly at all systems dependent, right? And for me, photogrammetry, sorry, I'll back up. For me, photogrammetry is the technology. What I see the big picture of where it plays is it is the beginning of standardization to me. It's something that we can start now automating because it's a process that we can count on. I've got 1 minute, 50 seconds. Okay, I'll just end here. I want to kind of go through, let me back up. Every full arch patient will become edentulous. So I want you to understand where photogrammetry fits. Why do I say this? We struggle with restorative issues because we don't pay attention to the universally established principles for restoring the edentulous patient. We ignore them, right? And so that's why we struggle. What are those records? Well, there are 8 of them. If I were to make this edentulous patient a perfect denture, the perfect denture would be made in-centric at the right vertical, optimal aesthetics, ideal occlusion, it would fit soft tissue. What's the difference in full arch? Well, there are 3 additional records. I need ideal bone reduction, I need abutment selection, and I need to capture implant position. So the point being is this implant capture becomes the key record, it becomes the enabling record. And photogrammetry allows, it's one of 8 records. That's what I want to be clear. It's only one of 8. In and of itself, it's useless. But merged with other prosthetic data, it becomes very valuable. And now we can really enter into the digital world, and photogrammetry is opening that door. 30 seconds, bone reduction, abutment selection. Okay. Again, photogrammetry just gives me this data, implants in space. I have to merge it with prosthetic data for it to be useful. Now I get that file and I can send it anywhere in the world. I can send it to your office to print. I can send it to your local lab to mill. We can mill it ourselves and ship. It doesn't matter, but the data is critical. I've got 10 seconds. The perfect prosthesis consists of these 8 records. Photogrammetry is one of them. And with that, I will end 1 second. Here we go. Thanks to everybody for attending. Hopefully this was valuable and will contribute to your profession. Thank you.